Are you unsure if you're pregnant? Missing a period or feeling different can be overwhelming, and the uncertainty can take a toll on your emotions and daily life. You might have a lot of questions swirling in your mind. Is it too early to test? Should I go to the doctor? What if I get a false result? In this video, we're going to unravel the mystery of pregnancy tests and help you understand everything you need to know about them, from how they work to what the results really mean. What is a pregnancy test? A pregnancy test is a tool that can help confirm whether a woman is pregnant. It works by detecting levels of a hormone called human chorionic gonadotropin, HCG, often referred to as the pregnancy hormone. This hormone is produced by the cells that form the placenta after a fertilized egg attaches itself to the lining of the uterus. How does it work? Let's break it down. When a woman becomes pregnant, HCG levels rise rapidly, and can usually be detected in both urine and blood about 10 to 14 days after conception. A typical pregnancy test is about 99% accurate when used correctly. This means that when you see that pregnant indicator, it's a reliable sign that your body is undergoing changes. When to take the test? Timing is key. The best time to take a home urine pregnancy test is after a missed period, but you can test as early as 14 days after possible conception. Some tests are sensitive enough to detect pregnancy a little earlier, so be sure to read the instructions carefully. Morning is the magic hour for testing because your urine is concentrated, which makes it easier to detect HCG levels. Drinking too much liquid before the test can dilute the hormone, potentially leading to a false negative result. How to take a home pregnancy test? Taking a home pregnancy test is straightforward. Here's how it typically works. 1. Collect your urine. You can either dip the test strip into a container of urine or hold it in your urine stream. 2. Wait for results. Results usually show up within 1 to 2 minutes, but make sure to check the package insert for specific timings. 3. Read the results. Depending on the brand, the results might appear as a color change, a line or symbol, like a plus or minus, a clear answer like pregnant or not pregnant. If you see a positive result, congratulations. HCG is present, indicating pregnancy. But remember, a negative result doesn't always mean you're not pregnant. It could simply be too early or a result of incorrect testing. Blood tests, a more detailed option. If you want a more accurate and detailed confirmation, blood tests are available but need to be done at a medical facility. There are 2 types of blood tests. 1. Quantitative HCG test, measures the exact amount of HCG in your blood. 2. Qualitative HCG test, simply checks if HCG is present or not. While blood tests are more accurate and can detect pregnancy earlier, they are more expensive and require a visit to a healthcare professional. Why should you take a pregnancy test early? Knowing if you're pregnant as early as possible is crucial. Early detection allows for better health monitoring and may require some lifestyle changes. For example, if you confirm your pregnancy, you may need to start taking prenatal vitamins, avoid certain foods, and stop harmful habits like smoking or drinking alcohol. What if the results are positive? If you receive a positive result, the next step is to schedule an appointment with a healthcare professional. They can confirm the pregnancy with a blood test and guide you on the next steps for your health and the health of your baby. What if the results are negative? A negative result can feel disheartening, especially if you're experiencing signs and symptoms of pregnancy. If your test is negative but you still suspect you might be pregnant, wait a week and test again. Alternatively, consult your doctor for a blood test, which can provide more definitive answers. Can medications affect test results? Some medications can impact the accuracy of a pregnancy test. Here are a few to be aware of. Promethazine, allergy medication. Parkinson's disease medication. Sleeping tablets. Some antipsychotics, like chlorpromazine, opioids, like methadone, tranquilizers, anticonvulsants, medications for epilepsy, infertility treatments. Interestingly, alcohol doesn't affect pregnancy tests because it doesn't interfere with HCG levels. However, it's essential to note that alcohol can harm fetal development, so it's best avoided during pregnancy. Understanding false positives and negatives. There's a possibility of receiving a positive result even if you're not pregnant. Conditions like certain tumors or cancers can lead to increased HCG levels. That's why it's crucial to follow up with your healthcare provider if you have any doubts. Conversely, negative tests can mean a few things. No pregnancy. The test was taken too early. The test wasn't done correctly. How to choose a pregnancy test. Pregnancy tests are widely available at drugstores, pharmacies, and even convenience stores. Prices can range from $1 to more, depending on the brand and features. Some modern tests can estimate your conception and due dates, but be cautious as this information may not always be accurate. Final thoughts. Taking a pregnancy test can feel like a roller coaster of emotions, and it's perfectly normal to feel anxious. Remember, understanding the process can help alleviate some of that worry. Whether you receive a positive or negative result, it's important to seek guidance and support from healthcare professionals and loved ones. Don't forget, pregnancy tests are a tool to help you understand your body. Use them wisely, follow the instructions, and trust your instincts. Your health and well-being are paramount during this time, no matter the outcome.